rapidly in Ontario. The government has ended the state of Brandon with that. So we're going to continue on and hopefully
Oh, I'm back.
see him a little bit afterwards. But let's move on to something else. We're going to talk about. Oh, actually, we're going to go back to Dr. Deonandan. This is a very important topic, so it is. I am happy that we do have you back. We're talking about the variant spreading rapidly in
Yeah.
Ontario. The government has ended the state of emergency. As I mentioned, they've lifted the stay-at-home order. Things are reopening up slowly. Kids have been sent back to school, and it really does seem like a recipe for disaster. What do you think about that?
I think it is a tad early to be opening up. We don't really have our ducks in line to manage the new variants. We need better screening tools. We need better guidance for how to deal with outbreaks of new variants. And really, our cases have come down to where they were in October when we were considering closing down the last time. So it seems a bit early. In addition, schools are closed. Schools are opening rather, and it seems wise to give the schools a couple of weeks of time to see if they will accelerate transmission before we open some additional things from a data management standpoint, if nothing else.
Right. And so now we're seeing and hearing about the fact that maybe we should wait a little bit longer before everything else opens up. And then you throw in the COVID-19 variants, particularly the UK variant. Is there any way that we can avoid a third, more deadlier wave?
There are three things we can do. First is we act early, we act hard. For the first sign of increased transmission, we start closing some things. Second is that we deploy extraordinary public health assets like better testing, much better contact tracing, particularly backwards contact tracing. And most importantly, we accelerate the vaccination program. If we can harden our most vulnerable populations against infection, then the cases might rise, but the death toll will be low.
And so let's talk about these rapid tests. So many of them, millions of them, are sitting unused across the country. Could putting those to use help get a handle on the spread of the virus?
Oh, yeah, absolutely. In particular, the rapid tests that we have a somewhat higher than comfortable false negative rate. But the way we use that kind of test is in surveillance. So, in particular, asymptomatic surveillance that you find in schools or reassurance testing for people who need to go back to work. If we do regular rapid test usage, we can monitor the state of the epidemic in places like schools and know when we need to pull certain other levers.
Okay, let's talk about France. It's now making new vaccine recommendations for people who have already had COVID. What does that mean?
Well, if you've already had COVID, then maybe you do not need the vaccine, or at least a priority spot on the vaccine recipient list. So that's odd. The Brazil variant may actually cause reinfection for COVID recovered people. So it's a bit of a gamble that they're doing. France has a crisis right now. They don't have enough vaccines to go around, and they're dealing with a pretty strong wave. So they're pulling out all the stops to make sure they have enough vaccine doses to go around.
All right, Dr. Deonandan, thanks so much for joining us this afternoon.
Thank you.
And